Good afternoon. My name is Veripamwe Hipothe. I'm here with Bianca from Rare Diseases. She's going to tell us more about the organization and what it is that they do. Good afternoon, Bianca.
Hi, good afternoon. Thank you for sharing this special moment with us. And the Namibia Alliance for Rare Diseases was formed in 2019. The alliance means Multiple Sclerosis Namibia and Cancer Association of Namibia, or Kanti Foundation, came together and decided we have to do something for rare diseases in Namibia because we do not have enough voice out there, we do not have enough impact out there. And since then, rare diseases globally took center stage for rare diseases. Patient advocates and patient organizations coming out strong to support patients suffering rare conditions. And that's where we are standing right now in Namibia as an organization, not for gain, to support and provide the necessary awareness that's very critical for patients to get the right diagnosis and ultimately go on to treatment as soon as possible.
And being here at the Namibian Health Exhibition, what is it that you think healthcare workers can do to help shed light and just to help highlight what is happening with rare diseases within the country?
Thank you so much. We have noticed that health professionals do not have enough knowledge how to diagnose and treat rare conditions. So that is obviously a very big challenge because we need them to be experts in specializing in these complex conditions. That also shortens the medical odyssey of treatment and the patient's journey with rare conditions. So the general time for diagnosing a rare disease is between 5 to 9 years. We also get rare conditions that's going undiagnosed. So you can imagine how challenging it is to treat a patient that's not even diagnosed because they can't find a diagnosis for it. So I would like medical professionals to really collaborate with us, come on board in terms of clinicians being very much aware. We recently had a beautiful outreach where we're inviting clinicians to collaborate with us for Willie-Prader syndrome, WPS, for example, where we work closely with South African support organizations on this. And from there, with international organizations, the same with Gaucher disease, also working with international organizations. So we have the network and the connections to work with other international organizations that have the ability to do research because we are not there yet to do research. So for us, we have that component of the good networks that can take it further, and we are here and we are ready. We just need the clinicians to work with us to make a greater impact so that we can have a stronger voice also out there. Yesterday we had the Minister of Health here, and she loves private public partnerships. And I think this is in our favor that we come together, we sit around one table, and we really collaborate with patient organizations and patients because we need the voices of the people holding the data. Otherwise, we cannot even focus on other things like health technology assessment, for example, which is also very important on the care pathway for patient diagnosis.
And do you have any platforms where general members of the public or even healthcare workers can inform themselves about rare diseases and what is going on, and where we can educate ourselves just to know?
Yes, so we actually started by doing a media call in 2020, if I'm speaking correctly, to inform people about the organization, the Alliance, to say, please make contact with us. And that was a great start because through that we could get the data from people living with rare conditions. We cannot live in isolation without a database because with this we can make changes and impact and policies and get the budget going for what medicine is essential and what is important. So yes, we would like people to make contact with us if they are going through a moment of not knowing where they find themselves, even through the process of getting the right diagnosis, because a lot of times we're having patients that are not being diagnosed. They're being sent from doctor to doctor to doctor, and you can imagine the psychological impact it has on them, the financial impact it has on them. And you know, stress is something that we would like to avoid at all costs, because this encourage or triggers pain and pain symptoms. And this is something we do not want our patients to go through. We would like to keep them comfortable. We would like to manage things on their behalf. But for that reason, we need the necessary input and support from all stakeholders to make a greater impact.
So, is there any final, maybe, I don't know, message that you want to send to some of our viewers of where they can contact you or how they can contact you, maybe?
Yes, please. We are on socials. Facebook is Namibia Alliance for Rare Diseases. On Instagram, it is Rare Diseases Namibia. But I think if you go on Google search, just go for Rare Diseases Namibia. That's the easiest way to do it. I can also be contacted directly on email rarediseasesnamibia@gmail.com. Cell phone number 0811 423 543.
I would just like to say thank you to Bianca for sitting down and talking to the Namibian Health Journal.
Thank you so much.